I don't think there's any question. You and I both would say that there's a lot of success stories out there. Both from the type 2 diabetic standpoint and even the weight loss. One of my concerns about the weight loss is I think we're pushing the limits of some of the max doses to get the outcomes that the patients expect. But we had a customer in the other day, and Jeff and I kind of double teamed him because he looks great. His physique is miraculously different. He is thin, but doesn't look ill. He is extremely pleased with what it's done for his A1Cs and his blood sugars. He's thrilled with how it's helped him maintain his weight. His biggest concern is that he's having some nausea, and it rolls through the night, and he says, I'm just kind of tired of getting up every morning, and I just don't feel good. I just don't feel like I want to eat. So we talked a little bit about that. We actually suggested that he use a digestive enzyme, because as you slow the gastric emptying, you may not be digesting your foods thoroughly. So that was our route that we were going to take. But this guy was so thrilled with his progress and his overall health from the use of GLP-1.
Yeah, that's an incredible story, and kudos to him for being able to lose weight, and blood sugars are better under control.
But he also made the lifestyle changes. His diet's incredibly immaculate, and he's getting his exercise, and that's so important.
Yeah, and those are the types of success stories you want to hear, and that's what you want to be seeing, especially initiating a medication like that and saying, well, lifestyle changes need to occur as well. And if you don't, you may still lose weight, but you may not be as successful as you were really hoping to be. Bouncing off of that, I have one really quick success story. I had a patient that I started on one of the GLP-1s, and within 3 months of starting it, and we kept it at the lowest dose the entire time, his hemoglobin A1C dropped from like an 8.0 or something along those lines to under 6 within 3 months. And
that's incredible.
It is. It was incredible. And we also, we did a few other things that, because things were, metabolically, he was not doing great, but it was pretty incredible. The guy felt better. He looked better. Numbers wise, significantly better. So I was very pleased that we were able to keep it at the same dosing as well. Another success story that is sort of an ongoing thing that we're working together on is another patient has been utilizing it in the injectable form and been trying to figure out how similar thought process of the nausea that's uncomfortable. And it was some experimentation on where she was administering it, and ended up going from a location in the thigh to a location in the belly. And those are both reasonable places to put it as long as there's subcutaneous tissue there. Nausea went away. Nausea went away, regardless of whether she had food in her stomach or not. And again, hemoglobin A1C is down. Weight is down about 10 pounds over the course of 2 or 3 or 4 months. But she's also making the lifestyle changes. She's doing right by herself. So they are, again, you don't want to call them miracle drugs but
penicillin was called a miracle drug at one time. So I think we might be getting close to these drugs being some miracles for some patients in particular.
Yeah, and being able to have a patient come and visit with you or Jeff or Kayla or whomever at the pharmacy and bouncing those ideas, the digestive enzyme, I wouldn't have even thought about that. That's fantastic.
His symptoms just seem like you're just not digesting your foods.
Right, sure.
And I don't know if we're right. It's not going to hurt him to do a digestive enzyme.
Right.
And he's at the age where his enzymes are probably naturally falling off anyway. So, but that's all part of the programs that I think between you and I and our pharmacy staff, working together and collaborating together and learning from our patient population, back to that triad of care.
Right.
A practitioner and a pharmacist and a patient working together to get the very best outcomes.
That's the way to do it.
Yeah, it is. So it's interesting that you talked about moving the injection site and getting a change. let's talk about what we have on the horizon.
Yes.
Our conversation is going to change a little bit about some of the exciting news that we have. I find it interesting that you talked about changing the injection site and getting a different outcome.
Right.
On the positive side, a reduction in nausea. In October, I was in Houston at a international compounding seminar, and we knew this was being worked on, but we were introduced to the work being done by the Professional Compounding Centers of America in the development of a base to put these GLP-1s and semaglutide in particular into a sublingual suspension to be administered into the mouth and the oral cavity for absorption through the tissues there, instead of using an injectable and the need for a needle.
Right.
It's taken them a while. They needed to prove the perfusion of the drug across the mucosal median. Semaglutide in particular, we call it a chubby molecule. It has a very, very high molecular weight. So even in a tablet form, which is on the market, it's very, very poorly absorbed.
Right.
Less than 1% of the drug from a tablet is absorbed into the bloodstream.
Right. Well, and then you couple that poor absorption with an unhealthy gut.
Yeah.
And who knows how much you're actually getting.
Exactly.
I didn't mean to.
No. You're exactly right. But we've kind of come full circle. The base has been proven to be stable. The stability of the base is a big thing. And the size of the batches that they were manufacturing, as they ramped up their production, they had to make some changes because they saw a change in the stability with the larger batches they were doing. We have the base. We actually have a few prescriptions. It's a semaglutide. We're starting at 1 milligram per milliliter, and then we would be dispensing that into glass bottles like this with dosing syringes. We're recommending a pretty conservative starting dose. There's a steep learning curve. I've been part of several pharmacist-driven pharmacy consultant meetings trying to figure out where do we start, what's the dosing. A lot of that's unknown.
Right.
And because we don't know a lot about the long-term ramifications of even using the injectable, so we're recommending starting at a very small dose and working up. We don't feel that rapid weight loss is healthy. We want to put together information with us as a team, and even using some scanning from one of the gyms that we've talked about, getting muscle mass statistics and tracking that information, so that the first rule is do no harm.
Right.
So let's make sure we're not harming somebody. One of the biggest things that we've talked about as a pharmacy staff is consulting on people how important it is. Their protein intake needs to be adequate. They need to get some exercise. When you're losing weight and you're losing it too fast, you're going to lose some muscle, and that's not a good thing.
Right.
We don't want that. So we need to be very, very cognizant of what that can do. And again, starting at a low dose and gradually increasing it, and monitoring and tracking and communicating with our pharmacy friends across the country that are also going to do this, so we can learn from each other, and down the road really
collaboration.
Yes.
Yeah. And that's one thing, from a healthcare perspective, from a prescriber's perspective, of being able to lean on a pharmacist or being able to lean on another healthcare professional, especially one that understands the mechanism of action, understands the pharmacology behind it, being able to not only ask those questions, but also to reinforce those lifestyle changes, sort of what you're alluding to with portions and exercise. And we don't want to lose weight fast. And this is going to take some time for your body to absorb it and for it to start making a difference and to help you start losing weight.
To me, it's a big change.
Right.
It isn't just taking something to lose some weight. It's really changing how you're treating your body and your system and your metabolic rate, so that the outcome is positive and healthy.
Right.
But I also see, I talk about communicating with our compounding pharmacy friends across the country to learn. I see you and your practitioners that are prescribing it also learning from each other
much so.
and calling on each other so that you're sharing information and we get a real good handle on where we need to go with this.
Because you don't, like you said, do no harm. And if we're not learning from one another, we're not doing right by our patients.
Right.
So it's it's an absolutely necessary.
It's kind of one of those, we're not competition, we're colleagues.
Right.
We're helping each other so that the patient gets the best outcome.
Yeah.
One of the things that my staff and I have talked about in the whole lifestyle and dietary changes is you're decreasing your appetite. The satiability is obvious. People aren't hungry. But the problem is they need to make sure that when they do eat, it's good food.
Right.
Because if they're filling up on empty calories, they're doing themselves up. They're harming themselves more.
Right.
So it's like draining purified water out and putting dirty water in.
Right.
You've got to really make sure that you're losing some body mass. You're going to lose a little muscle. You need to try to battle that as best you can. And one of the main things is make sure that I like to talk a lot about eating a rainbow. Make sure your food has color and you're getting adequate proteins and those kinds of things.
Yeah, because you're going to fill up faster. You're going to. Right. You're right.
So if you start with a bag of chips, you're full.
You're full, and you've got nothing to build that muscle or maintain that muscle.
Right.
But you're going to. Anytime you lose weight, you're going to lose muscle. There's really no way around it unless you're able to maintain an exercise component, and that's something that is really, really, really important.
Yes.
And your exercise is an extremely important component to all of this. You're going to lose muscle anytime that you're losing weight, and not having the appetite that you once did is even more difficult. So putting in that protein as the first piece, as opposed to, like you said, a bag of chips, but also adding in a smaller portion of the protein, but the rainbow of foods as well.
Yeah. Make sure your foods have some color to them.
Make sure your foods.
Yeah.